Hi, Jana. Hello.
Hello.
Uh, so am I audible properly? Hello.
Hi, Arti, we can hear you. Yes.
Okay, sir. Okay, sir. Thank you. So now we can start with the webinar. Good afternoon, everyone present here. A warm welcome to all of you for today's enlightening webinar hosted by Gyan Vardhini by the team Clinsav. We are thrilled to have each and every one of you joining us for what promises to be an insightful and encouraging session. Just a second, few more doctors are joining, I guess. Uh, okay, I'll just continue with it. So, in today's fast paced world, the pursuit of knowledge is more important than ever. It is the quest of knowledge that drives us to continuously seek new insights, ideas, and perspectives that can help us grow both professionally as well as personally. Today's webinar is titled as Breastfeeding, and it is designed to empower you with valuable insight and practical knowledge that you can apply in your daily life and professional endeavors. Our distinguished speaker for today's webinar is Dr. Sirish Kumar, a dedicated pediatrician with the intensive experience and expertise. He has done MBBS from MGM Medical College, Navi Mumbai in 2008. Also DTH, Diploma in Child Health from Balabhai Nanavati Hospital in 2016. He is currently serving at BG Care Maternity Home, Bandra East, and offering private consultation in Lalbagh, Kalasaki area. He has been serving for 8 years and brings a wealth of knowledge and expertise to today's discussion, ensuring that you can receive the highest quality of information and insight. But before we proceed further, let's take a moment to express our gratitude to each of you for taking the time out of your busy schedules to be a part of this webinar. Your presence here today underscores your commitment to continuous learning and personal commitment development. So, without further ado, let's embark our journey of discovery and enlightenment together. I encourage you to actively engage with your speaker, and you can ask the question in the chat box. You can share your thoughts in the chat box. Once again, welcome to today's webinar. We are excited to have you here. We look forward to have an encouraging and fulfilling experience together. Thank you. Over to you, Dr. Shirish. You can start
Uh,
on with your point.
okay. Thanks, Ms. Aarti, for such a warm welcome. Good afternoon, everyone. I am Dr. Shirish Kumar, and we are here today to discuss one of the most important topic, pediatric point of view, that is breastfeeding. Not only pediatric, but also gynecology point of view, that is breastfeeding. Once the baby is born, it is the first boon which we introduce to the baby is the breastfeeding. By definition, the breastfeeding is the feeding of an infant or young child with the breast milk directly from female human breast. That is a process which is called as a lactation, not from any baby bottle or with from any other container. Okay. Uh, Today we are going to discuss the importance of breastfeeding, its benefits to the child and mother, also how to do breastfeeding, what are the common questions which we face as a pediatrician regarding breastfeeding. Definitely, you must have also come across some routine questions from mothers and family members regarding the feeding of the baby in the initial stages. With today's presentation, we would like to try to find some solution for such problems and queries. For that, I would like to start with the anatomy first. Uh, in brief only, we will discuss the anatomy of the breast. The breast is mainly consist of fat tissue and the mammary glands, and this mammary gland is made up of lobes. So each lobe it contains is a major branch of alveoli, milk duct, a- and hello, am I audible? Hello.
Yes,
Yes,
sir,
Dr.
you're
Shirish.
audible.
Okay, yeah. So, so, so the adult female breast contains 15 to 20 lobes in each breast, and each lobe contains 20 to 40 lobules. The milk which is produced in the alveolar cells is carried out to the milk sinuses via milk ducts, and then they further process forwarded to the lactiferous ducts. The lactiferous ducts get collected
Dr.
to the hello.
Dr. Shirish, sorry to interrupt you, but your, the slides are not moving. So,
Okay. In the milk sinuses, it is forwarded to the lactiferous ducts, and the lactiferous ducts get collected to the dark part of the dark part, which is called as the alveoli and areola, and then they open up into the nipple. So during the pregnancy, there are many changes happens in the female's body. So also changes that happens during the pregnancy in the female breast are nipples and areola enlarge and darken during the pregnancy. Small bumps, that is called as the monochromatic glands, appear on the areola, and the female nipple gets softened to prepare the nipple for the breastfeeding. After having brief discussion regarding the anatomy of the breast and it's the breast structure, let's see how the actual milk is produced in the breast. This process is mainly carried out by the let down reflex, which is actually initiates with the suckling of the baby. When the infant suckles at the nipple and areola part of the breast, the pituitary signal to the pituitary gland is given in the brain and to release the two hormones, mainly prolactin and oxytocin. When the prolactin causes the alveoli to take nutrients from blood supply, that is proteins and sugars from the blood supply, and turn them into the breast milk. And the second important hormone, oxytocin, causes the cells around the alveoli to contract and eject the milk down to the milk ducts. This passing of the milk down in the ducts is called as a let down reflex or the milk ejection reflex. The let down reflex is experienced by the female in numerous ways. Normally, infants begins to actively suck and swallow. Milk may drip from the other upper side of the breast. Mother may feel tightening or the fullness of the breast, and also uterine cramping because of the oxytocin. And a female may feel thirsty also in this process. This is the common what we call as a breast-brain cycle. When the baby sucks to the nipple and areola, the impulse goes to the brain, and from pituitary, two hormones are get secreted, prolactin and oxytocin, and which prolactin causes production of milk, and while the oxytocin causes forward contraction of the lactiferous lobules, so that the milk gets excreted. This is the same, the milk reflex. The two major hormones which play important role in the lactation are the prolactin and oxytocin. Prolactin is responsible for the milk secretion by acting on the milk secreting cells, that is the alveoli of the breast, and the oxytocin is responsible for the contraction of the milk from the glands into the lactiferous sinuses and lactiferous ducts. Such milk which is produced from the breast is contains of all the nutrients which are important to the newborn baby. The breast milk contains mainly proteins, carbohydrates, vitamins, and fats. The proteins, the human milk protein milk contains two types of proteins, mainly whey and casein. The approximately 60% part of the protein is made up of whey, and the other 40% is of casein. Also, it also provides good immunity to the baby. The lactoferrins inhibit, which are also made up of proteins. The lactoferrin inhibits the growth of iron-dependent bacteria in the gastrointestinal tract to prevent the baby from the iron deficiency anemia. Also, secretory IgA also works to protect the infant from viruses and bacteria, especially those that the baby, mom, and the family are exposed to. It also helps to protect against E. coli and possibly allergies. Other immunoglobulins, including IgG and IgM in the breast milk, also helps to protect against the bacteria and viral infections. In protein also, only the lysosomes is an enzyme that protects the infant against the E. coli and Salmonella. It also promotes the growth of healthy intestinal flora and has an anti-inflammatory function also. Also, the bifidus factor supports the growth of the lactobacillus that protects the baby against harmful bacteria by creating an acidic environment where it cannot survive. By these two entities, the diarrhea chances are very much becomes less visible in the breastfeeded children infants. Fats. The fats are very much necessary for the development of brain, absorption of the fat soluble vitamins, and it's a primary calorie source for the baby. The long chain fatty acids are needed for the brain, retina, and nervous system development. They are also deposited in the brain during the last trimester of the pregnancy and are also found in the breast milk. As the breast is full of this more amount of fat, the fat soluble vitamin, that is A, D, E, K, are uh, are provided to the baby. The amount and types of vitamins in the breast milk are directly related to the mother's vitamin intake. Fat soluble vitamins include vitamin A, D, E, and K, are all the vitals to the infant's health. Water soluble vitamins such as vitamin C, riboflavin, niacin, and pantothenic acid are also essential, which are provided through the breast milk. The primary carbohydrate which present in the breast milk is the lactose. Lactose is the primary carbohydrate found in the human milk. Lactose helps to decrease the amount of unhealthy bacteria in the stomach, which improves the absorption of the calcium, phosphorus, and magnesium. It helps to fight against the disease and promotes the growth of healthy bacteria in the stomach. Here is some comparison between the human milk and the cow's milk. Uh, the water content is almost the same. The energy is also somewhat same only. That human milk, breast milk provides around 65 kilocalories against the cow's milk, which provides 67 kilocalories. The proteins are 1.1, carbohydrates 4 gram, fat 3.4 grams. It also provides calcium around 28 milligram, not as compared to cow's milk on lesser side, but for infant it is sufficient. It doesn't provide any or we provide very small amount of iron, because of which the children who are on breastfeeding for long time, more than 6 months also, can develop iron deficiency anemia in the later stages. Uh, Now I would like to discuss regarding some types of human breast milk. The colostrum. Colostrum is the early milk is produced in the late stage of pregnancy till the first 4 days of after delivery, and it is rich in antibodies. Colostrum is mainly thick yellowish white fluid which is secreted in the immediately after the delivery, and which it contains lots of antibodies which are very much helpful for the baby to develop its immunity. The transition milk is produced from the day 4 to the day 10 of the after delivery, which is lowering some protein and comparison to colostrum. And the natural milk is produced from approximately after the 10 days after delivery until the termination of the breastfeeding. Also, I would like to some highlight on the fore milk and hind milk. The breastfeeding mother makes standard breast milk that is can be divided into 2 types. That is fore milk and hind milk. Once the baby starts suckling the breast, the fore milk is a milk that is that baby drinks at the beginning of the feeding, and the hind milk follows it. Normally, what happens when baby started feeding suckling, initial part of the breast is little watery, and it satisfies the thirst of the baby. And the milk which is coming after the fore milk, it is full of fats and proteins, which satisfies the hunger of the baby. So whenever the patient is complaining or the mother is complaining that baby is passing more amount of urine but is not gaining the weight, or the baby is asking for the milk every after 1.5 hours, or the frequency of the feeding is more, that time you should ask that lady regarding the how often, whether you are pushing the one side of the breast and offering the second breast after that, or you are using both the breast at a time for feeding. Because and you should also advise the mother that once the first one breast is completely emptied by her by feeding, then only you should go for the another breast. And for that, you have to always have a check on the nipple, whether the when the baby is suckling, whether the milk is coming or not. Because many times baby keeps on suckling in order to get the milk, but the milk is not coming as that part is already got empty. So in that case, you have to shift the baby to the another place and start feeding from the that side. Once the both the place milk places are completely emptied, and if the even after that the baby is feeling hungry, then only you can give for the go for the formula feed. Otherwise, you should continue with the breastfeeding. As the breastfeeding is a beneficial for child, it is beneficial to the mother also. This promotes the bonding between mother and child. It prevents the uterine bleeding in the mother after delivery. This is a natural form of family planning also. This reduces the risk of breast and ovarian cancer in the mother. This saves the time and the patient expenses need not to be used for buying milk product or other healthcare. Also, the benefits for the baby are this provides the best possible nutrition to the young child. It reduces the incidence of cough and colds, ear infections, bronchitis, pneumonia, meningitis, and diarrhea through its protective factors. It protects the child from colic, asthma, eczema, nose and food allergies. It is essential for the optimal physical, emotional, and mental development of the child. Breastfeeding children are also found to be more smarter. Uh, this is regarding the how long to the breastfeeding should be done. Many times female complains that she has to feed every early or even every half an hour early to the baby, or she says that she keeps on feeding for a long time. There's more than 30 minutes, more than 40 minutes. She keeps on feeding, but she is not sure whether the baby's stomach is full or not, or baby's very hungry is satisfied or not. So in this case, we should limit the time of the breastfeeding, or we should more concentrate on the how much time to be breastfeeded. So the newborns, which are very small and their stomach is also small, so you can nurse them for 5 to 10 minutes per breast every 2 hours. This comes about 10 to 12 feedings per day. Per day. In the beginning, there is only colostrum and not much, which is not much in quantity. So in the initial days or in the first 3 4 days, you have to feed them with it often, but in the short durations. Once the baby gets older, baby's hunger is also increasing, or baby's stomach size also increase. So you can nurse them frequently for about 10 to 15 minutes per breast, every two and a half hourly. And by the end of 6 months or when the baby breastfeeding, you can feed the baby for 20 to 40 minutes per breast. That's also 3 to 5 times per day. So once you, as I say, you should complete the first one breast at a time. When it is empty, then you should shift to the baby to the other side. So it takes about 10 to 12 minutes to finish one side. After finishing 2 sides, then only you should go for the soft feed if at all it is required. When we say normally in the hospital, others are advised that you should feed the baby too early. But it is when if you calculate the too early means around 12 feeds per day, which is not possible practically. So at least 9 to 10 feeds has to be given to the baby in a whole 24 hours. Out of 9 to 10 feeds, I suggest that at least only 2 to 3 feeds should be given in the night hours. The night hours for a baby is considered to be at from 10 to 11 p.m. to in the night till the 6 to 7 in the morning. So in these night hours, if the baby is fed at 10 or 11 o'clock, then if the baby is sleeping for 4 5 hours, then the baby should be allowed to sleep for that long period of time. Because the nights will be very, very important for the baby also for to have proper growth. So by 3 or 4 o'clock, baby again will start crying and you can pay that at the time. So by 2 or 3 after 2 3 hours, taking by 6 or 7 o'clock, you can give another feed. So in the night hours, you should give at least 2 or 3 feeds only. Remaining 7 to 8 feeds you should finish in the daytime. In the daytime, baby should be awake every after 2 and 2.5 early, so that baby will not have hypoglycemia in the daytime. Okay? So this is the kind of the timing of the for the breastfeeding. There are very few contraindications where breastfeeding is to be avoided. One is active and untreated tuberculosis, or if the mother is taking any radioactive compound, so really like chemotherapy for any cancer disease, that time you should not breastfeed. Or if the baby, the mother is on illegal drug or with the HIV infection. The proper way for breastfeeding. How to initiate the breastfeeding. Normally, we should stimulate the baby's mouth by opening or touching the mouth to the nipple, and then the baby opens his mouth wider, bring the baby near to the breast, and then there should be a proper latch of the baby to the breast. This is a picture of the latch. Many times, if the latch is not proper, then baby may not suck the breast milk properly. So the baby's mouth should be wide open. The chin should touch the breast. The cheek look like a flatulent, and the lips are flanked out, and the breast look like a full and round. And with this proper latch, if the baby is sucking the milk, then you can hear the sound of suck and swallow. Okay. In this also, the nipple look long and rounded after the breastfeed. If the latch is proper, the baby also doesn't have any problem while completing this feeding and breathing cycle also. So breathing and feeding, which goes on simultaneously, baby can do properly if the latch is proper. While detaching the baby, you should use your little finger, place on the gums of the baby to open the mouth of the baby, and you can detach from the nipple. It's also important to have proper position while breastfeeding. There are so many kinds of positions which are there. You can see in this picture. So cradle position or the cross cradle, laid back position, sideline position, football position. Football position can be done for the 2 baby also when there are twins. So, but for each mother and for each baby, the position is different. The position in which the mother and the child is comfortable, that that position should be followed by the lady. So she can take below the leg, above the leg, below the at the back, and while and she has to adjust her position, comfortable position for herself and for her baby. So many times we say mothers are confused whether the baby's hunger is satisfied or not, or whether he is getting enough milk or not. So the signs which that are shows that a baby is getting enough breast milk are the baby is contained for 1 to 2 hours after the feed, and baby goes to sleep for at least 2 hours. Then he passes clear dilute urine for 5 to 6 times per day. Baby passes bright yellow water stool 6 to 8 times per day, and he regains his birth weight after 2 weeks. Many times mothers complain that the baby is passing stool for many times, or baby having loose motion after starting feeding. So normally this stool is of yellow to grayish in color. It contains millet-like substance in this stool. It is kind of sticky. It contains some water. This is a normal food for a baby. And even if this kind of stool is baby is passing for 10 to 12 times, it is normal for a baby. Even the baby is not passing, doesn't pass this for consuming 3 to 4 days, that is also normal for the baby. So you should assure the patient that you should not to worry regarding the loose motions. These are not loose motions. These are the normal stool, which is every baby passes who is on breast milk. This is something regarding breast milk storage uh, nowadays all the women are also working, so they have to store the milk. They have to express the milk in the container, and then they have to store it in the refrigerator, which is a common practice nowadays. You can see. So unless being used immediately, we should refrigerate the milk within 1 hour. The warm milk in the container of the lukewarm water or running water. So you don't heat the milk directly or on the high flame or in the oven. You should use the container of vessel of warm or lukewarm water, in which you can put the container which contains the breast milk, and you can use that milk. Once the milk is thawed, it should be used within 24 hours. And once the milk is heated or warmed in the double heat boiler of water, you should use it immediately within 1 to 2 hours. And if it's not used, you should discard that. There are few complications which can be faced by the mother while breastfeeding. there's like breast pain, biting by the child, and the too much of milk which can be stored out in the container. Sometimes mothers may have mastitis, breast abscess, breast engorgement, or the sore nipple. Out of these all, the sore nipple is the commonly seen complication in the clinical practice. The sore or cracked nipples, they are mainly caused because of the improper latching or the oral thrush to the baby because of the dry skin or the dermatitis or by biting. Okay. It's a last slide for the discussion. What nutrition should mother should have while breastfeeding? The mother who is breastfeeding should have proper nutrition, well nutrition or well balanced nutrition she must have, so that she can provide that all nutrition to her baby. So eat well balanced and varied diet. Then breastfeeding mother should at least have 500 calories more than her daily requirement. Check with the doctor about taking vitamins and iron tablets. And she should mother must have 8 glass of water fluid. It is 8 ounces daily. Then avoid or limit the caffeinated drinks or maybe 1 or 2 cups daily, and avoid alcohol. So this is regarding breastfeeding. At the very best of my knowledge, which I shared with you today. Uh, for any questions, Miss Aarti, you can please tell me about regarding the questions from the audience.
Yes, sir, sure. Just give. Sir, you can see the chat box, or should I give you a call for the same?
Yeah, just need to forward the same because I can't see chat box.
Okay, so Dr. Snehal Makwana is asking you for what is the recommended feed, demand feed or too early it
Uh,
is. Yeah.
Normally, initially we ask for the demand feed because colostrum which is secret in the initial 3 4 days, it is small in amount. So at that time, baby may not satisfy with his hunger. So baby cries away after little time. So at that time, you can give a demand feeds, but it is recommended that give at least feed the baby 2 and 2.5 early. Don't wait for the baby to cry a lot for 3 hours, or don't keep the gap of 3 to 4 hours. Many of things like what happens, uh, baby's sugar level goes down because of as the baby is sleeping, the baby's sugar level goes down, and baby keep on sleeping only. And we didn't come to know whether baby is he sleeping because of his satisfied or it's hypoglycemia. So to avoid hypoglycemia, we should always wake up the baby every after 2 and 2.5 early and feed the baby. Maximum 3 hours gap should be there, but not more than that. As the baby grows up, baby then the gap will be automatically increase. So after that, the gap will be of 3 or 4 times. But that time also the baby's feed will increase, so that there is no problem having that much of gap. Hello.
Yes, sir. Okay,
Uh,
so
so
I
so for
yes, sir,
is
you
it
can
better to keep
continue.
a gap of 2 and 2.5 early?
There's a next question from Dr. Ajit Jha. Most of the first-time mothers suffering from problem of inadequate milk production. What's the solution for that?
Uh, Mostly in the primary gravida, this problem arises that they are not getting enough amount of milk. But for them, it is they should be advised to breastfeed, take the baby to their breast every too early, so that the baby when baby, the breast milk is going to produce only when the baby is going to suck the nipple and the areola part. If the baby didn't suck, then the milk is not going to produce as the cycle is not taking place. When the baby is going to suck the nipple and areola, that time only the prolactin and oxytocin is going to secrete from the brain, pituitary gland, and these two hormones, which are responsible for the production of the milk as well as the forward motion of the milk from lactiferous duct to the nipple, is going to carry it out. But if the baby she doesn't take the baby to her place, then this cycle will not develop, the bond will not develop. So to develop this bond and to develop this cycle, it is advisable to the mother that she should take the baby every 2.5 early, 2 to 2.5 early to her breast. Let the baby suck the breast Whatever amount is coming, 5 ml, 10 ml, that should be given to the baby. Afterwards, as the day by day, as the cycle is going to develop, even the milk production will be increasing. You should assure the baby that patient that the milk production is going to increase once the baby starts suckling the breast. Initially, the amount, the size of the stomach is also very small. It's around 3 to 5 ml in initial first 2 days. Then it becomes 10 to 15 ml of size. They by these only as the size increases, even the breast milk amount is going to increase with the development of this breast cycle.
Also, the artificial feeding in such cases are advisable. If yes, from when?
If the if the mother is stressful, or there are some complications regarding of the pregnancy or during the preparation process where the milk is uh, not only not at all produced by the breast. In that case, you have to give top feed or the formula feed to the baby, and you can give top feed right from the day one of the baby, day one of life.
There's one more question. When should mothers start weaning?
Uh, it is say that exclusive breast milk should be done till 6 months of age. So it is advisable to continue breast milking for till 6 months, and after that you can start weaning food. For nowadays, for working mothers, we advise. I will tell you some practical points also, because if the mother is working and she is getting a leave of maternity leave for 6, say 6 months, so this she should start winning the after 4 months also. She can start winning food after 4 5 months, so that by the time she can join, the baby is well versed with the winning food, which can be given to the baby when mother is out of the house for her work. So you
Okay.
can ideally you can start winning by 6 months, but in cases of where the mother is working, you can start winning food by the end of 4 months or 5 months.
There's one more question from Dr. Snehal. Do all the children need supplements like calcium, folic acid?
Uh, as I showed one chart in our presentation, there are a comparison between human milk and the cow's milk. So you can see the calcium content of the breast milk is little on lower side, and it's 28 milligram only, as compared to cow milk, which is contains around 120 milligram. So normally the breast milk is a provides all the nutrients which is required to the baby. The supplementary foods, the quality of food which we are taking nowadays, if you compare the quality of food 100 years ago, which we were taking, and then the quality of food which are nowadays being present, it already contains less vitamins, minerals as compared to earlier days. So to provide the proper nutrition, it is advisable to give calcium supplements or vitamin D supplements we offer, or multivitamins to the baby, so that they should not have any deficiency in early stage only. And normally folic acid and iron supplements we start by the after the 6 months of age.
Okay, thank you, doctor. Do we have any more questions for the same? There's one doctor saying, but nowadays, as per WHO guidelines, mothers are advised to start weaning even after 1 year. Will that milk be helpful for the baby? Any health complications to mother or child if feeding is continued till 2 years?
Uh, we can give breast milk till 2 years of age, but the amount which of the breast milk, it goes on reducing after 6 months. Initially, when as we say, the initial amount of breast milk is small in amount, is only 10 to 15 ml per feed. So these on at the peak is of 3 to 4 months. At the age of 3 to 4 months of baby, the breast milk is on higher side. Only maybe 600 to 700 ml breast milk can be produced per day. But afterwards, this amount of milk production goes on decreasing as the day passes. That's why we have to start weaning food after 6 months. So after 6 months, the amount goes on decreasing, but the child is growing. Child requires more nutrients. Child requires more amount of energy. So for that, we have to start with the weaning food after 6 months, and also to have to provide all kinds of nutrition. The breast milk is not enough in the later stages, means after 6 months of age. The initial 3 4 months is fine if the baby requires only breast milk. But if you consider the child which is around 1.5 year of age, giving only on breast milk, he must can develop vitamin D and nutrient deficiency. That's why we should start the weaning after 6 months.
Uh, do we have any more questions? Thank you, Dr. Snail. We'll keep continuing the sessions every month for sure. Thank you, Dr. Ajit Jha.
Big thanks from Clinsav team to Dr. Shirish Kumar for taking this up and sharing knowledge on such an important topic. Also, thanks a lot to all the participants for your precious time for this Gyan Vardhini session. Yeah, Aarti, up to you.
Thank you, sir. Thank you to all our webinar participants for your active engagement and valuable contribution. Your presence have made this today's session a truly insightful and enriching. We are looking forward to welcome you again to our future events. Keep learning and stay inspired. Thank you. Thank you so much for joining.
I would like to thank Gyan Vardhini team and the team Clinsav for giving me this opportunity. And also, I would like to thanks to all the participants. I would like to special thanks to Dr. Rufet Kazi and my friend Mr. Milind Rokde, who has helped me to prepare this presentation. Thank you.
Yeah, thank you again, Dr. Shirish. Yeah. So we'll be closing the session now. Wish you all have a great day.
Thank you.
Thank you so much, Dr. Shirish.